So I've been here over 30 years, and I started here when nobody even knew what Santa Clarita is. It was a little farming community, and Henry Mayo was a very small country hospital. We have become a full-service hospital in the last 10 years or so. We provide every service you can think of. We have a cardiac surgery unit, we have become a STEMI center, we have a state-of-the-art intensive care unit, we have a great emergency room, and very recently we started with the neonatal ICU. We got every specialty you can think of.
Our history is rich and our change is profound. These many advancements and our culture of caring have led to our new identity. We've replaced our familiar wreath with a new circle of care, symbolizing people coming together for a common purpose, the health of our community. This is the backbone of our brand promise. It's important and it matters in everything we do. What is a brand promise? Simply put, it's the intersection of what matters most to our patients and what we do best. It's supportable and sustainable. It's what we live day in and day out and evident in everything we do.
This is where my children are raised. They go to school with some of the patients I see here in the emergency room. And I care about them. I care about my kids' friends. I care about my patients. I care about this community. And more importantly, as a doctor, I care about their health.
Our promise? We care. Yes, it's that simple. It says it all. It also reflects the internal We Care patient communication standards that are already taking root throughout Henry Mayo. It's the best thing a hospital can promise, to care about a patient as a person, to care enough to be deeply involved in our community, to care enough to deliver the latest techniques and treatments. Your caring changes lives in the most profound ways.
I think it's got to be the small things that you do going into a patient's room, offering them juice and them just being so thankful that you're there and so helpful, or, just actually talking to someone and congratulating them, or just speaking to them in general. The little things are really, they mean the most.
Okay, so when a patient first comes to us, many other places may start the patient on a modality like a hot pack or something like that. No way. I want to see every little bit about that patient. So we do an extremely detailed evaluation. We look at every joint, every muscle, everything that may be pertaining to that area of injury so that we can assess on that particular person what's too tight, what's too weak, what needs to be done, as opposed to saying, oh, well, they're a rotator cuff and so this is the protocol I apply. No, it's very individualized.
It's really not about us. We are here for a patient, and patients are the VIP. And by giving the patient the best care on everyday basis, the care that they deserve, we're not only better as a physicians, we are better collectively as a hospital and medical community. When we collectively work for the best interest of the patient, putting as a patient-centered facility, we get a better result, and we do that every day.
Technology has helped us to be much more efficient at what we do, and it's helped us to be faster. All the digital technology that we have, we're able to manipulate the images, see things better, do a better job at diagnosing early lesions. Caring is sort of trying to put yourself in the patient's shoes and figure out what it is, where they're coming from, and to try to help understand that. And then once you understand what the patient is thinking, then you're able to kind of relate to them better and say the things that they need to hear. It's a very fulfilling thing. I've been here at Henry Mayo for 26 years, and I still look forward to coming to work in the morning.
My parents have practiced here for a long time, and I've heard of Henry Mayo for a very long time in my house. And it's so exciting to be here, now back at Henry Mayo as a physician, walking the same halls, seeing the lobby where I used to sit as a child, and it's really exciting to be here and give my gift as a physician now. I would say that Henry Mayo has the most advanced microscope for intraocular surgery currently right now in the Santa Clarita Valley. And if I needed cataract surgery done, I would get it done here.
When I do my job right, quickly, efficiently, competently, I know I'm saving lives. I know I care.
The spirit of what this is all about, it's the well-being, both physical and psychological, of the patients and their families. A lot of that involves going into a patient's room and dealing with the nurse call or the bed, or a lighting issue or heating, temperature, they're too hot, they're too cold, and that's, an opportunity to express, say, compassion or maybe cheer them up even a little bit.
I love working at Henry Mayo. Every day I have a new story. Teaching someone how to breastfeed or watching them deliver their baby, you can't beat it. Well, it's a great power, and it doesn't stop at the doors here, because when I'm at the market or I'm at the gym or I'm anywhere, I see people that, oh, Donna, you were my nurse, and I feel it everywhere I go. I don't take this nurse badge off when I leave, so it's very nice.
We invite you to tell us, how do you show you care? Please call the marketing department today and share your story.